Hey everyone, we're back here for tip number 24 in our Medical Exercise Training 101 ebook video series. Now, tip number 24 is really toward my physical therapy colleagues. So here's tip number 24. I'm going to read it first and we'll talk about it. I'm a physical therapist. Can I set up an MET service in my office or develop an MET program in my office? Yes. Medical exercise training is the next logical steps for patients discharged from your physical therapy practice. Now, if you don't know, I'm a therapist, been one for 30 plus years. The concept of medical exercise training grew out of our physical therapy clinics. I realized once our patients were discharged, we needed a structured protocol-based exercise to continue to manage their conditions. We started the MET concept in the early 1990s because insurance carriers were reducing the reimbursement for physical therapy services. We didn't want to simply discharge our patients and leave them out there on their own in the cold. So we put together a structured exercise program. Initially, we called it aftercare or a step-down program where patients would continue with their exercise programming, but they would do it in the office under the supervision of one of our exercise techs. These clients were deemed medically stable and their insurance benefits were exhausted. We discharged them to the aftercare program, so they weren't receiving any more physical therapy. The aftercare program used personal trainers or staff members that we had trained to supervise the exercise programs. Now, I would confer with the staff members. We developed the exercise program. The patient was discharged. We made it very clear to the patient they were discharged and they were coming in for just the aftercare program. The program was protocol-based, so we knew exactly the exercise and the progressions the trainer was going to take the client through, and the trainer was communicating back and forth with us. The aftercare program did not bill for physical therapy services. We contacted the insurance carriers and requested reimbursement for a medical membership or an aftercare program. So it was very clear exactly what we're doing. No physical therapy, but we have this exercise program. We think it would benefit Mr. Smith to be in this program. We have a referral from his physician for this. There's no physical therapy. The cost of the program is X amount of dollars per month. We clearly explained the program and the credentials of the staff members supervising the program. We built the aftercare program at $100 a month. Now, this is back in the 1990s. Once we put these clients in the aftercare program, their physical therapy charts and records were stored away, and a new MET chart was produced for each aftercare client, not patient. We made it very clear to each patient and had them sign a disclosure to ensure they understood physical therapy services were discontinued and they were now in the aftercare program. Folks, we wanted this to be squeaky clean. We wanted to cross all the T's, dot all the I's. It's no longer physical therapy, it's the aftercare program. Our staff members, including personal trainers, exercise physiologists, and rehab technicians, supervise the aftercare sessions. They use our MET protocols to manage the client's exercises and progressions. We use a very strict criteria to ensure each client was appropriate for the program. Just because they've been discharged because of their lack of insurance reimbursement doesn't mean they were a particularly good client for the aftercare program. Remember, separate the MET program from physical therapy services. Look at the 5 most common conditions you treat in your physical therapy practice and develop aftercare or post-rehab protocols for those conditions. This is the foundation for your aftercare program. We even have a link here where you can actually purchase our post-rehab protocols. Remember, they're post-rehab or medical exercise training protocols. They're not for treatment in physical therapy or for the physical therapy patient. These protocols are geared more toward the chronic client and at the tail end of the subacute stage. Once you have an MET protocol for each of the 5 most common conditions you see, you now have standard guidelines for the program. I guarantee you will sleep much better at night with these protocols in place. Folks, protocols are the backbone of every aspect of medicine. Everything in medicine, physical therapy, nursing, surgery, pharmacy, is based on a protocol. If you put a protocol in place, there's no freewheeling by the staff members with regard to the exercise programs. There are specific guidelines, there are criteria in place. I guarantee you'll sleep a lot better. And remember, as you learned in PT or chiropractic school, every aspect of medical care is protocol-based, as I just said. Protocols minimize mistakes, they maximize outcomes, and stay away from the thought of just winging it with your in-house aftercare program or MET program. Even if you bring in an outside trainer, make sure they adhere very specifically to the protocols you've put in place. You understand your scope of practice. You understand the guidelines that your practice needs. Now, the client is no longer in physical therapy. You need to make sure you set up guidelines for that aftercare program because it's under your roof and it's your reputation. Let me continue. Market the aftercare program to physicians, other therapists, and chiropractors in the community. Also market the program to as many entities as the community as you possibly can, as in churches, community centers, because seniors want something that will allow them to be more active. They still want to golf, they still want to dance, they still want to get out and do things. Don't leave them just home on their own with the excuse, your physical therapy coverage ran out. That's a poor excuse. We can do better than that. Forgive me. One of the biggest problems we find with physical therapy clinics, once their patients are discharged, they are pretty much left on their own. An aftercare program can help your practice stand out from other therapists and chiropractors in your community. An aftercare program will improve your practice outcomes. Now, please, for the physical therapists out there, don't take this personally. We're not talking about you if you're already doing this. We're talking about the other folks on the other side of town or in the other county who don't do stuff like this. Aftercare programs are vitally important to the overall continuity of care for those individuals that are transitioning out of physical therapy. Insurance reimbursement is possible for the aftercare program. You can bill the insurance carrier on a monthly basis for a medical membership. Communicate with them, talk to them directly. The very first time we dealt with a medical membership, it was for a patient that had been seen by one of our referring orthopedists. He'd undergone an ACL reconstruction. This young man went to school in Minneapolis, Minnesota. We were seeing him at our office in the District of Columbia. We treated him, got him to the point he was ready to go back to school. His mom called me a couple of weeks later and asked if I would put together an exercise program and forward it to the aftercare program in Minneapolis. Now, this is in the early 90s, and I immediately had a problem with this because I'm thinking, well, these trainers are going to try to do physical therapy. Well, I called the facility, talked to the director of the program, and they made it very clear. This isn't physical therapy. This is the aftercare program. We're not going to bill it as physical therapy, but the charge is $100. And we find for most individuals, insurance carriers, they're willing to pay this because they don't want the client to regress back to where they were. It makes good sense, and it's a good investment, and it's even better investment for you, the therapist, to have one of these in your own facility. So with that, the medical memberships include a monthly reassessment and a program update done by the exercise physiologist or personal trainer that's supervising the programs. Reassessments should look at strength, flexibility, balance, endurance, and function. If the client exhibits any red flags during the session, a referral back to the physical therapist or is necessary, or back to the physician if the therapist feels that's necessary. The therapist can determine the client's needs for physical therapy treatment or refer back to the physician. Folks, the need for aftercare programs in physical therapy settings, chiropractic settings, any rehab type of setting is vital now. We realize these changes in insurance reimbursement are here to stay. We'll get some minor give from the insurance carriers, but it is what it is at this point. So having individuals that are working in your aftercare program that have the proper training, I highly recommend our medical exercise specialist program. You go over to medicalexercisespecialist.com to get more information, but we need these aftercare programs that are blended into chiropractic or physical therapy so we have a good transition and it gives us the utmost possibility for a positive outcome for the client. So with that, thank you for watching. Please go over to MET101ebook.com. Download a copy of the ebook. You'll get more tips, videos, and thank you for watching and best wishes in building your practice. Take care.